Hi friends, Dr. Nancy Trimbley, putting the power and knowledge of your health back in your hands. So can chiropractic help somebody that's had back surgery? In my opinion, in my office, absolutely, positively yes. I've got a long history of people with back surgeries. My husband, when we were married only 2 years, had surgery on his neck. It was an absolutely necessary surgery. He lost the use of his right arm and his right leg. So I could kiss the neurosurgeon that did his back surgery. So that gave me a lot of experience with people with surgeries, and I learned that when you have a fusion surgery, there is nothing that's going to mess that up. That is probably the strongest articulation in your body. It's not really an articulation, but nothing's going to budge that. But the problem is that right above and right below the surgery, those areas start to deteriorate at a much more rapid rate than they normally would, meaning arthritis, bone spurs, and disc and joint degeneration set in way more quickly. This is an x-ray of an extreme case of a back surgery, and you can see these screws that are into the spine here. This is somebody's lower back, and you can see these stabilizing bars. This person also had disc replacements. But the issue here, you can see where these yellow arrows are, is that there's significant deterioration above the surgery. This is the problem. And also, you have to remember that surgery only addresses one component of your back. There are layers of components. In the lower back, there's the pelvis and how that influences your lower back. There's soft tissues like muscles and the ligaments and the tendons. There's also how your hip joints articulate with the pelvis, which then affects your spine. In your neck, you've got the shoulders, you've got the upper thoracic spine, you've got the cranium and cranial alignment that will affect your neck. So surgery only addresses one little piece. It is not like a redo. It's not like a new man or a new woman. It doesn't completely rebuild you. It only changes one little thing. That's why they used to have a diagnosis in the diagnosis code book called failed back surgery. They've changed that now, but the reason why that was there was because very often, although the surgery might help with one little thing, it is not the complete answer. So you definitely need a chiropractor if you've had back surgery. If you want to avoid back surgery, you definitely need a chiropractor. Find somebody with a lot of experience in that. We do have a lot of expertise. So if you have any questions, you can reach out. That's all for now. Putting the power and knowledge of your health back in your hands.